Guillain-Barré syndrome is a rapid-onset muscle weakening that is caused when a person's immune system damages the peripheral nervous system. The immune system mistakenly attacks the nerves, destroying the myelination on the axons. It normally starts with a tingling or numbing in the muscles, most commonly starting in the feet. Over time, it will travel up through the person's body, making it difficult to walk or make general movements. While there is no cure, a person can recover through months of intense rehabilitation to help them relearn how to walk and move. We all know about neurons and how they have their dendrites and the soma and the axon and the myelin sheath. The myelination on the axons help the impulse travel down the axon faster so that our brain can communicate with every part of our body, even our toes, within milliseconds. Now what happens if the myelination is destroyed? Guillain-Barré is an autoimmune disease that attacks your nervous system. This is when your body's immune system attacks and destroys the myelination on the axons of your neurons. Most people first feel it in their feet. It starts as a tingling or pins and needles feeling in your feet. Eventually they go numb and it works its way up your body until you cannot move any of your muscles. GBS is not inherited or contagious. It is often triggered by minor infection. People with GBS have a hard time moving their face muscles, eyes, often walk unsteady and have trouble talking, loss of bladder control, increase in heart rate, paralysis, difficulty breathing, and blurred vision. People with GBS often have an increased risk for respiratory diseases and heart attacks. First reported in 1916, named after Guillain-Barré and Stroll. The two major subtypes of this disease are acute inflammatory demyelinating polyneuropathy and acute motor axonal neuropathy. 1.223 of 100,000 people in the U.S. are diagnosed. It is diagnosed in a variety of people. There are no specific patterns to who is diagnosed with GBS. To diagnose it, doctors will perform a lumbar puncture to look for an elevated protein level without any increase in white blood cell count. They may also use an electromyogram to observe muscle activity. While performing the EMG, they may also do a nerve conduction velocity study, which measures the speed in which signals travel along the nerve. Individuals with GBS often have slowed impulses. The average cost per patient is $318,966 because the patient is often hospitalized for a long period of time. This syndrome has no cure, but there are many ways to lessen the severity of it. Treatment is mostly found and done in intense care units. Plasmapheresis and high-dose immunoglobulin treatments are used. The IVIGs are used to inject the proteins that the immune system already has to attack and try to get rid of invading organisms. The body takes time to heal after this treatment. This treatment is usually effective if used within 2 weeks of the symptoms. When the body is recovering, the person can sometimes be placed on a ventilator and heart monitor or other. After the person begins to recover, they are placed in rehabilitation centers to strengthen and help resume everyday life activities. About 80% of patients walk independently at 6 months, and about 60% of patients attain full recovery of motor strength by 1 year.